So today we're revising infertility. We're going to be using the NICE CKS guidelines. We're going to be looking at it from a primary care point of view and what the guidelines suggest for management in the UK are. So what to do if your patient comes in complaining of not being able to conceive. So the first thing you do is you'd look for any obvious, you'd take a good history and physical exam, and you're looking for underlying obvious underlying pathology. So if you take in a female, take a menstrual history, gynae history, look for any previous surgeries, anything that could symptoms of thyroid disease, symptoms of any systemic illnesses, previous history of STIs. So you're looking for something, anything that can be a direct reason for infertility or reduce your chances of conceiving. If the female patient has any history of PID or obvious menstrual, some gynae history that can cause infertility. And in the male patient, again, looking for previous take a full history and examination, look for any structural abnormalities, any previous history of infections, or any other reason that could directly be a cause for infertility. All these patients, you want to do an early referral to secondary care. You wouldn't need to do any further investigations in primary care. Again, the same thing for a lady over the age of 35. So these two groups of patients get an early referral to secondary care, to infertility clinics. If there isn't any of these things, then then what you want to do is initially ensure that the patients have been trying to conceive for at least 1 year, and that would mean having regular intercourse every 2 to 3 days. And during that time period, if they could or had managed to optimize, and going forward to optimize their lifestyle to promote fertility. So if they're smoking, to stop smoking; if they're drinking alcohol, to stop or reduce alcohol intake; if they're not of a normal BMI, if they can lose weight or gain weight to get to a healthy BMI. All these things will promote fertility. So if they're doing all these things and then the patient gets to 1 year, at this point we can start investigating. So in a female, there's a few things to look at. In a female patient in primary care, you would initially do a mid-luteal progesterone. So if you get the progesterone 7 days before she is to come onto her menstrual period, so day 21 of a 28-day cycle, we can see if she's actually ovulated at day in that cycle. If she is having longer cycles, however, there is some regularity. So say she's having a 35-day cycle, So you'd minus 7 days, and you'd check progesterone levels 7 days before she's going to have a period. So that would be day 28 of a 35-day cycle. You'd and if it's longer than that, however, there is some kind of regularity, so you can what you would do is you would just keep doing progesterone levels every week until she started her period. This can give us an indication of whether she is ovulating or not. We also offer all females chlamydia screening that are struggling with fertility. In ladies that are having systemic symptoms of thyroid disease, whether that's hypo or hyperthyroid, we can check their thyroid function tests. In ladies that are having symptoms of suspected pituitary tumor, or they're having galactorrhea, anything suggesting a problem with prolactin, we can do prolactin levels as well. We can also, in ladies that are having irregular menstrual cycles, we can check their gonadotropins. So their FSH and LH levels. If they're having irregular cycles, then we're looking for, it would give us an indication of whether they're having an ovulation disorder, such as PCOS or primary ovarian failure. And so that would be all the investigations that we do in primary care in the UK for men. After taking a full examination, after doing a full history and examination, you can do a semen analysis. And that you can check for if the sperm count is low, or if there's any abnormalities in the sperm. If anything abnormal does show on the report, they get referred to secondary care. If it's a normal analysis, then there's no further investigation for men. We'll also offer men struggling with infertility a chlamydia screening test. So once some of these, or as many of these tests that there's an indication to do, once you've done them, you would then refer these patients to secondary care for further investigations if they're still not conceiving. It's been 1 year. We've started the initial investigations in primary care, and then we refer on to secondary care to see if there's anything, for any secondary care investigations and proper management to be done there. Throughout this process, it can be very stressful for the patients, so it's good to offer counselling support throughout the process.